people entering. YouTube live 9:30 9:30 નો ટાઈમ આપો પણ લાઈવ થઈ ગયું
એ તો આને 9:55 ફૂલ કરી દી just before
કોઈ વેટિંગ માં હશે કોઈ નથી ત્યારે એડિટ કરીશું પહેલા મીટિંગ ની બહાર નીકળો કારણ કે 9 વાગ્યા 9 એકચ્યુઅલી અમને ટાઈમ આપ્યો હતો તો 9 વાગ્યાનો આપ્યો એની જગ્યાએ આપણે 30 નો કર્યો ક્યારે કાલે કીધું ને 10 વાગે છે ઓન ધ સ્પોટ કરવું હોય એટલે YouTube માં પણ આપણે શેર કરવાનું હતું
એવું નહીં તો તમે મીટિંગ પર સ્ટાર્ટ કરી દીધી છે
મીટિંગ
ચાલુ
ચાલુ થઈ ગયું બધું આપણે સેટઅપ થઈ ગયું બધા એટેચ જેવી કપડામાં જોઈન થશે ને
તો આપણે આને અહીંયાથી પોઝ કરી શકીએ
नहीं मेरा खुद का ही काम किया हुआ है तो सेल्फ फंडेड लिखना
सरस्वती नमस्तुभ्यं कामरूपिणी विद्यारंभं करिष्यामि सिद्धिर्भवतु मे सदा या देवी सर्वभूतेषु बुद्धिरूपेण संस्थिता सरस्वती नमस्तुभ्यं कामरूपिणी विद्यारंभं करिष्यामि. A very good morning to one and all present here. We have gathered here on this virtual platform to get insights on development of biosensors for rapid diagnosis of oral diseases. But before we get into the core learning of it, let us understand what exactly a biosensor is. A biosensor is an analytical device used for the detection of a chemical substance that combines a biological component with a physicochemical detector. A biosensor typically consists of a bioreceptor, which could be an enzyme, antibody, cell, nucleic acid, a transducer component that could be a semiconducting material or a nanomaterial, and electronic system, which includes a single amplifier, processor, and display. On that brief introduction, I, Dr. Samar Chelani, Assistant Professor in Department of Orthodontics and Dentofacial Orthopedics, a part of KM Shah Dental College and Hospital, which is a constituent college of Sumandeep Vidyapeeth, on behalf of the Institutional Research Committee, the organizing team of today's state-level webinar on development of biosensors for rapid diagnosis of oral diseases, and its collaborative partner, Institute of Advanced Research, the University for Innovation, Gandhinagar. On behalf of the entire team, I extend a warm welcome to you all. The chanting of mantras is the most popular form of worship in Hinduism. And thus, at the commencement of any event or program, we believe in taking a moment to bow down in gratitude and invoke the blessings of the Almighty, by the grace of whom all our work is made possible. I request all the participants of this meeting to kindly up your volume as we pray for a minute.
वक्रतुण्ड महाकाय सूर्यकोटि समप्रभा निर्विघ्नं
Thank you. I now request Dr. Jasuma Rai, IRC Coordinator, KM Shah Dental College and Hospital, Sumandeep Vidyapeeth, to kindly welcome the Dean, KM Shah Dental College and Hospital, to deliver the welcome address.
A very good morning to all of you all. I, Dr. Jasuma Rai, Professor, Department of Periodontology and Institutional Research Committee Coordinator, welcome the Dean, Dr. R.V. Subramaniam, sir, to give the welcome address.
A very good morning to all of you. Am I audible?
Yes, sir.
It gives me great pleasure to welcome you all to this webinar, which is jointly organized by the Cambridge Dental College and Hospital of Sumandeep Vidyapeeth University and by the Institute of Advanced Research, the University of Innovation, Gandhinagar. Which is jointly organized by the Cambridge Dental College and Hospital of Sumandeep Vidyapeeth. I think there seems a slight lag, probably because of the internet connection. It also gives me great pleasure to welcome all the various participants from all over the country. In fact, I can see a few of my friends in the participant list. Dr. Punit Ahuja, Dr. Ravikant Manyam, Dr. Gadiputi Sridhar, Dr. Meghanand Nayak, Dr. Dinkar. So very nice to see you all. I also would like to take this pleasure to welcome Dr. Manish Parmar, the Registrar of the Institute of Advanced Research and the University of Innovation. In fact, I would like to inform you all that this particular webinar is a joint effort of the Institute of Advanced Research, the University of Innovation, and Cambridge Dental College and Hospital because of concerted efforts by Dr. Manish Parmar, the Registrar of the University, and Dr. Bhavna Dave. We are very thankful to you both for coming out with such an excellent idea to organize this webinar, which is especially related to dentistry, that is especially oral pathology and oral medicine, the development of biosensors in the diagnosis of oral diseases. I hope one of these days, they come out with a biosensor which can find out what goes on in the mind of a woman. So probably that will be very useful for most of us. Jokes apart, I once again take this opportunity to welcome all the participants to this webinar. Thank you all. Jokes apart, I once again take this opportunity to welcome all the participants to this webinar. Thank you all.
Thank you so much, sir. I now take this opportunity to welcome the Registrar, Institute of Advanced Research, IAR, Dr. Manish P. Parmar, to kindly address the gathering.
Am I audible now? Am I audible now?
Yes, sir. Yes, sir, you're audible.
Yeah, thank you very much. So good morning all. Respected Dean, KMSA Dental College and Hospital, Dr. R. Venkata Subramaniam, Dr. Bhavna Dave, Professor and Head Pediatric Dentistry, IRC Coordinator, Dr. Jasuma Rai, Expert for today's workshop and Assistant Professor IAR, Dr. Alok Pandya, HODs, Organizing Committee members, and dear participants. It is indeed a matter of great pleasure to welcome all of you to the workshop on the development of biosensors for rapid diagnosis of oral diseases. Let me introduce our university. The Institute of Advanced Research, the University for Innovation, Gandhinagar, was established in 2006, initially as a research institute with the support of then President of India, Dr. APJ Abdul Kalam sir, who inaugurated the institute, and the Prime Minister of India, who was then the Chief Minister of Gujarat, Sri Narendra Modi ji, who laid the foundation stone. The university is supported by the Puri Foundation for Education in India, established by Professor Nathuram Puri, who is leading industrialist in the UK with manufacturing and other businesses worldwide. Our campus is situated on the banks of Sabarmati River in Gandhinagar. IAR was awarded university status under the Gujarat Private University Amendment Act 2011. I am sure that you will feel enriched with knowledge after the completion of this hands-on workshop. Have a great time ahead. Thank you very much.
Thank you so much, sir. I now take this opportunity to welcome our guest speaker for the day. Our guest speaker Dr. Alok Pandya is an interdisciplinary researcher, academician, and administrator. His research work is broadly focused on nanobiotechnology, nanochemistry, and forensic nanotechnology. He is interested in the early design and development of paper microfluidic-based point-of-care diagnostic platforms for the early detection of disease-specific biomarkers. He has completed multiple projects from various competitive funding agencies such as SERB OPDF, DST, SERB, and GSBTM. He has published more than 52 research articles in high-impact, peer-reviewed international journals, more than 10 book chapters, and 2 Indian patents. Currently, he's working on development of indigenous rapid flow-through based point-of-care immunokit for the early detection of CRP and heart fatty acid binding protein on myocardial infarction. Dr. Alok Pandya is an assistant professor associated with IAR Gandhinagar. It is rather a pleasure, sir, to have you here with us.
Thank you. Very good morning to all of you. Am I audible?
Yes, sir.
So very good morning to all of you. Thank you so much for giving this opportunity to talk to the dental students and the faculties which are in this field, and also Sumandeep Vidyapeeth, who found that this area is something which needs to be talked about, or maybe we can explore the collaborations, like talking about what we are doing at IER. So thank you so much, Sumandeep, for giving this opportunity to talk about this, biosensors development in the oral diseases. So, so shall we start now?
Yes, sir.
Okay, so I will share my presentation. Okay. So is this visible now? My presentation.
Yes, sir.
Okay, so today, which I'm going to talk about is development of a biosensor for rapid diagnosis of oral diseases. Before I will start, this is about the oral disease. I would say I have seen in this list, like many senior people are also there, and some of the students, I think dental students are also there. So today, actually, I'm going to talk about what we have done in my lab, and what kind of work we are doing, what kind of innovative work and kind of diagnostic kits, what kind of diagnostic which we are developing in our lab, and how the same can be reflected for the oral diseases. Because my experience is mostly towards the cardiovascular diseases and some of the plant diseases, viral diseases. So if I summarize something like I think somewhat, I just forgot the name was described. Overall area is to developing something new diagnostic tool, the tool which are more affordable, which can be reached to the end users very easily, which is not very less false negative results, or more and more very accurate results. So we are focusing on developing of diagnostic tools, which is something very innovative with respect to any diseases. So we have started with the cardiovascular diseases, and then we have started with this plant viral diseases. And this is something which is very interesting topic, which I found and during discussion, like let's talk about the oral diseases. So I will talk about what we have done in our research work, and what kind of diagnostic kit which we have developed in our lab. And more importantly, I would like to understand from all senior people, those who are in the area of last many years. I have seen that some of the people are working in dental area from last 15-20 years. I would like to understand from them how I can help you developing a biosensor, keeping our technology in mind. So this session is actually, we have divided into two different things. First is I will talk about what we have, what kind of work we are doing, and how we have developed our diagnostic kits, which is mostly for CRP and cardiovascular disease biomarkers. And secondly, which we have another one is about how to develop a biosensors. How we can develop biosensor, what are the key things we have to keep in our mind while developing a biosensors. And maybe we'll talk about what are the applications in the oral diseases. Maybe some of them have heard about some of the term which I'm going to discuss in presentations, but maybe I'm just looking for more how this technology which you are developing can be useful to you. So let's understand oral scenario of real world problem. And if I'll talk about specifically oral diseases, so oral diseases mostly largely preventable. Like if you detect at early stage, I think many of the people are aware about this. So oral diseases are actually caused by the range of various factors, like including sugar consumption, tobacco use, alcohol use, or maybe the poor hygienes, and maybe underlying some social and the commercial determinants. So many diseases are associated with these oral diseases, and we are just worried about sometime giving this antibiotics and let's finish this. So we don't analysis, and we don't do the risk assessment of the diseases when any patient comes to the maybe in the clinics, and where at least you can some of the risk associated with this oral hygienes can be detected, right? So let's see what are the real world problem which I want to tell you before I start about my work which I've done. So real world problem, if you see that many issues which is in our world as related to the biology. We have almost 7.7 billion world population as of April 2019. If you see, we are struggling to get sustainable health, food, energy, water, and climate. And out of this, now we have faced in last 2 years as COVID-19, which was such kind of emerging diseases are very crucial. And we have not prepared for it, because every time we have to go to hospitals, maybe the tertiary hospitals, where we have to at least 24 hours to take RT-PCR testing. And we are not able to detect it very early stage, or maybe we are not able to detect it our home, something which is a point of care test. So the emerging disease is a really alarming situation these days. And you have seen that this the COVID-19, like any we take the saliva sample sometimes, and then we try to analyze the presence of COVID-19. So you can see how important, like if we can, like how for the dentist and maybe the oral physicians to having some sort of diagnostic kits, yeah, some sort of testing facility which patients can like it can be done at primary health clinic, also can be done at by home. So this is the situation which actually we have to be a little worried about, and therefore we have to focus towards making some point of care in our biosensors development. And if you see this world leading cause of death day by day and year by year, it is increasing. If you see the data comparison of 2000 to 2019, data is going to be increased. Like from, if you let's talk about heart disease, and therefore we started working on heart disease because 6.8 million in 2000, but then 8.9 in 2019. And if you categorically, if you see all the diseases like strokes and other respiratory infections and other diseases, also the situation is a little alarming, because the cause of death is getting increasing day by day. And somehow people are trying to connect this cause of death with oral hygienes as well, because people are think this is something not to be that is something point which does not need any concentrations toward this oral hygienes, because we have a humans naturally have some other diseases, but like if you connect with and associate with the oral health, and that is something which is people has to be understand. So why I'm giving the statistic, we do not know how much it's related to the oral health, related to the oral health hygiene. But anyways, we'll talk about how this is related to the oral hygienes as well. These are some of the diseases which is directly linked with it. So if you see in India, non-communicable deaths in India, the numbers, if you see 0.5 million deaths because of cancers, 1.5 million because of strokes, 30 million because of chronic respiratory diseases, and 62.4 million because of diabetes, and cardiovascular diseases deaths is something around 72 million. So that's actually made matter of worry, I would say. And therefore I've started working on cardiovascular diseases. Of course, there are other diseases also equally important. So because cardiovascular disease is prevalently increasing these days. So we thought, let's work on cardiovascular diseases. And if we see, and I try to understand what are the traditional diagnostics, like if you want to see, like, and many of the doctors will be maybe agree with me, what happens is that when any healthy individuals, when it happens any molecular alterations, so, and which something called proteomics and minor structural organ damage, then we are able to understand. And sometimes, like when we see minor structural organ damage, then we are able to identify some sort of diseases, whether it is related to any diseases, whether it is a cancer disease, whether it is a cardiovascular disease, whether it is an infectious disease. And sometimes when it reaches to the advanced organ damages, then we do the traditional diagnostics, high sophisticated instrument which we use to diagnose for diagnosis of such diseases. And later on it happens organ failure and the death will occur. So this is my worries here. Why can't we start able to detect at molecular alterations? That is something we required. Maybe we do at laboratory level, we send samples to the laboratory, but if we can do it in the primary health care clinics, and these molecular alterations, if we are able to detect it very early stage, things can be improved. We can save many more patients. So that was my focus when I started working on developing a diagnostic kits. What happens like if I do this? So I can, of course, reduce the survival rate. This is the statistics of cancer diseases, oral cancer diseases. Mortality rate, if we detected late, 79% of mortality rate. But if we detected early, then 11% of mortality rate. So that's something we can create the gap, like in terms of saving the patients. So this is how it is beneficial if you work on the technology where we can technology which can be able to detect diseases at very early stage. Now, what happens is that, like, if you see the general laboratory investigations, like if you see sodium, potassium, I think many of the, like all of you are aware about this. And if you have seen that, normally we are able to detect this all laboratory investigations at millimolar levels, like chloride, CO2, glucose, creatinine. And what we do is that some patients comes to us and we ask them to do a WBC, RBC and some things. And when we find something, oh, this is very high RBC counts or WBC count, and then we, let's give them medicines. And then if it is a more, then we allow them to be we admit them, and that's how we do these processes. So why can't we detect it very early stage at primary health clinic? Someone is coming to my clinic and I wanted to see whether it is high CRP level or very high inflammation levels. Why can't we detect immediately and we can start treatment immediately? Still we are rely on the laboratories. Still we are send our sample to the pathology laboratories. Reasons are many, but what I feel that some of the tests which are easily can be performed and at primary health care clinic or maybe at home, which needs to be focused, and that's why we have working on that. And if I'll talk about other tests which are includes a biochemical test or tissue studies which is related to the biopsy and something which is related to the dental problem, where also we send this sample to the pathology laboratories and they take some time, and then at the time the progression of tissues and can be cancerous tissues can be there. So we are not able to detect these things at very early stage. We are aware, I know about where patients are also a little lethargic about this, but also we have to be a little focused on like how we can detect those all laboratory investigation at very early stage. If I talk about specifically oral mucosa, because this is I found somewhere, because I found very little literatures about anyone is working on this towards oral biosensors and detection of oral diseases. But this is what I found something interesting here. This is a viral, bacterial and fungal infections. Maybe people are maybe agree with me, or maybe we can discuss later on which is actually in the oral mucosa. We can see the infections, viral infection like mononucleosis. And if you see epidemiology of this, causing agents is EBV. But here if you see statistics are just a second, I will. Okay, so if you see here, like statistics, 90% to 95% of world population is infected by the EBV. But let's talk about this diagnosis side and predisposing factors, which is actually normally started from the children age, where deep kissing with infected individuals, blood transfusions, and solid organ transplantations. So can spread for the infected parents and siblings as well. What diagnosis we do is clinical representations are heteroprofile antibody test, monospot test, and EBV infection test, enzyme immunoassay, specific antibody test like IgM and IgG. These all diagnosis we do. And normally these all diagnosis we do at a, not we do at a clinic. Normally sometimes we send the samples to the pathology as well. All right, and these are the treatments. Normally we'll start it when looking at the sums of the symptoms. Normally we prefer the symptomatic infections, and then we'll start the treatments. So when what happens, sometimes patients comes late and it is all in the very severe stage. So this is the one of the examples where we have to we can see like why we need to start a diagnosis early. This is a cytomegaloviruses, which is a prevalence, seroprevalence among adults is 50 to 100%. And if you see what are the diagnoses we do is a serological detections of CMV specific antibodies and IgG, CMV specific IgG antibodies, and immunofluorescence and radioimmunoassay. These are the diagnostic tools which we use. I will tell you later on, these all can be translated into the point of care testings. And therefore, I'm trying to explain you here why it is a matter of worry. These are the viral infection, and this is known through the symptoms, because since doctors are know about this through the symptoms. But if you do not know the symptoms, because symptoms does not mean it is a confirmation of any diseases. This is a herpes labialis on the mucocutaneous junctions of the upper lip. This is a viral because of viral infections. This is a herpes zoster of tongue. This is also because of viral infections. Maybe sometimes you are thinking that why it is important for dental problems, but patients can come from the dental issues, but can spread to the dentals, right? So we can start treatments, we can start investigation, we can start risk assessment. That's how we can build up the confidence with the patients as well. So but this is, we know this is a viral infection because of these reasons, because it is from some literatures, but we cannot differentiate when people come with such kind of a symptom. So how will you differentiate this symptom is because of what reasons? Let us talk about the spectral infections. Leprosy is caused by Mycobacterium leprae, and 90 to 60% of leprosy cases involved in the oral cavity. And what kind of diagnosis we do is histories, clinical examination, maybe some skin tests we do, and then we try to identify the bacterial infection. This can be translated into the technology. Similarly, let's talk about fungal infections, which is a known one, which is actually from literature. So I can see that this is because of pseudomembranous candidias, plates of HIV infected patients. Actually, you can see with how it look like. This is a chronic hyperplastic candidias at maybe in the mouth. So how we can differentiate, like this is although no, but how we can differentiate these fungal infections? So we can develop technology, point of care technology, where we can able to identify. We can also integrated artificial intelligence, where you can see the symptomatic, take the images of them, and we can do the algorithm image analysis. We can do that. I will show you later on. So apart from that, if I would see, and if I have seen in the website, what are the common problems related to oral health and related to the dental health is, so oral diseases affect nearly 3.5 billion people. Yesterday only I come to know these figures are a little alarming. And apart from this disease, which I talked about in previous slides, dental caries, tooth decay is one of the issues, common problem around the world. Periodontal gum diseases are actually have issues in the world. Oral cancers is actually very alarming situations. Orodental trauma, and also nomad diseases. Nomad diseases now we have, you can see that it is actually we have observed in the 2 to 3rd year of the ages of the students, children's. Right. So this is I have identified four oral diseases which is actually matter of worry, and which is actually linked and associated with the other diseases, which is I talked about in early, because sometimes we are not able to detect it early stage. It goes to that very advanced stage, and we can't able to detect it. So this is some of the news which I also found. I was trying to find out whether really it is a really alarming situation in India or not. So I just found some sort of statistics here. And I found in the situation of Kerala, maybe we are not able to find the statistics around India, but I found this statistics of Kerala, where periodontal disease malnutrition is 90%, and most of them are advanced diseases in a 50%, 30% of the children. That is actually in a situation of worry. Oral cancers to 14 in per lakh populations. Pre-cancerous diseases are 140 in 1 lakh of populations. So this is the situation in Kerala. Maybe this situation may be in some of them other states of the country. And dental fluorosis is also very important, which is in maybe of the two of these districts in Kerala is found. But that's how it needs to be detected at very early stage, maybe at the clinics or maybe by at home. So, and there is something which also I found, like 8 out of 10 children suffer from major oral health problems. And because of many reasons, majority of the children do not brush their teeth twice daily. 7 out of 10 children did not visit a dentist in the past 1 year. And you always wish to do that, but maybe they're getting maybe hesitate to come. But this is something which is a alarming situation, would like to say, because children, same situation is about the adults. Like 9 adults suffer from the major oral health problems. So what is the conclusion which I talked about a couple of slides is that some technology is required where we can detect infections, identifications of pathogens, maybe the other oral diseases which is I talked, Norma disease or maybe the oral cancer diseases are essential to mitigating oral and general infection in the humans. So we have to detect it very early stage. So that is something is need of an hour, I would say. So therefore it is important to detect disease at an early stage, and we can cure or save many patients on time. So nano biosensor is one of the best suited technology which I found, which can detect diseases at very early stage. So next question comes to in your mind, why and what is nano biosensors? Let's talk about, first I will talk about what we have done is that. Now concept is coming is there, and what WHO and government is focusing on that, let's do decentralized testing. Normally what happens in the centralized testing, you send sample to the healthcare facility and takes times to get results, and sometimes patients may, COVID, we have seen that sometimes we have people have lose many families. So decentralized testing is something is government is focusing on that, and something it is helping to your dental problems as well. So why can't we do testing at a healthcare facility, at home, at clinic, on-site test results are the focusing. But WHO says whenever you think about decentralized testing, you must have assured diagnostics. Assured, what does it mean by assured is, it must be affordable, it must be sensitive, it must be specific, it must be user-friendly, it must be rapid and robust, must be equipment free, must be delivered to those who need it. That's the criteria of WHO says whenever you make any kind of diagnostic kits and any developing any biosensors or nano biosensor. But majority of the techniques which is available right now doesn't follow WHO guidelines, which is some of them not affordable, some of them are not user friendly, where training is required, some of them are equipment free, and some of them can't be delivered, right? So what is the solutions like if you want to make a short diagnostic which almost fulfill all the criteria? So we thought about in our research work is that let's focus on lateral flow based technology, because this is a 30 years old technology and still we are stuck up at some of the pregnancy test only. And recently we have started with COVID-19 detection kits which people have developed, and they found that this is something which is more affordable these days. And why it is more affordable? And why it is extensively used by the people? Because of very easy design. I will show you in the demonstration. Easy design, they are sensitive and specific, and they are based on the paper microfluidic. Cost of the paper is a very cheaper. So paper microfluidic is one of the good options to make lateral flow based technology, and user friendly and easy interpretations. So it is almost fulfill the lateral like assured diagnostic criteria: affordable, sensitive, specific, user friendly, rapid, robust, equipment free, and can be delivered to the end users, right? Now let's understand what I have done this. Then I'll come to this demonstration part and components of the technology. So what I have done is that the first nano biosensor which I have developed is about cardiovascular diseases. As I told in my previous slides, I was focusing on what, because I got a project from Department of Science and Technology to develop a nano device for early detection of cardiovascular disease. So I have developed first nano biosensors on cardiovascular diseases, and how I started is same statistics I will show you. Like I was worried about, because 72 million people were deaths were in India and yearly. So why can't we work on this? So, but how you can minimize and how you can prevent this NCD and non-communicable deaths, and how we can minimize the treatment cost. There are only two ways to do is healthy lifestyles, which is actually not in my control, but something is my control is why can't we develop some technology where preventive health checkup is possible. So I thought about let's work on the preventive health checkups. So what I was now come to the conclusion is that how we can rule in and rule out the acute myocardial infarctions, because this chest pain happens because of many reasons, maybe inflammations, maybe pneumonia, maybe some gallbladder, gastrointestinal problems. We actually do not able to know chest pain is happening because of what reasons. So what we have thought, how can we rule out and rule in the possibility of AMI, right? So if it is due to the AMI, early diagnosis can be started and we can save the many patients. So what we found the statistics is that the death risk in cardiovascular disease is strongly linked to the time elapsed prior to the treatments. Higher death ratio 10 to 12% if we start treatment late. But if we start the treatment within a 6 hour of acute event, death can be reduced to the 1%. And that is something something which is actually important to work on it. Can we make a technology which can be able to detect the CVD problem at very, very early stage? So what challenge was to how we can find the appropriate biomarker. So in case of CVD, I think all the doctors know about this. FABP is one of the markers which release at very early stage when a person having any cardiac arrest. So we focused on the FABP and we tried to develop a technology for FABP, because this is something which released in the body within 1 hour of acute event. So this is the first product we developed. We started with the CRP because CRP is a common inflammation biomarker, and sometimes it will help in the dental problems as well. So what we have used, we started with the lateral flow technology, based technology, where what we have done is that paper microfluidic lateral flow amino acid based technology we have used. Let us understand what are the components in this lateral flow amino acid. So there are four membranes, because as I said, it's a paper microfluidic. So there are 4 membranes involved into this, and these are the 2 plastic housing. So in these 2 plastic housing, we assemble them like this, because the names of components are sample pair, conjugation pair, backing cards, and nitrocellulose membrane. Like you can see here, like this is a sample pair, this is a conjugation pair, this is the NCM, and this is the absorption pair. Maybe some of them people know about this if they have seen this, and I will show you today as well. So this is how we assemble and fabricate this lateral flow amino acid kits. This looks like this: absorption pair, test pair, conjugate pair, sample pair. So, and this is how entire kit is get assembled. Right, so we'll see it today, like how you can assemble it. So, but how it works, I think many of the people are aware about this. This is a upper plastic housing. This is a lower plastic housing, and here we put test lines in the control lines, where we put secondary antibody here, and primary antibody is actually conjugated with the gold nanoparticles. So what happens is that when you add your analyte, it binds with the gold conjugated antibody here. And through the capillary flow action, it reaches to the taste line, where the same another antibody is waiting there. So it will be make an immunocomplex formation there. It is something sandwich immunocomplex formation will be there. And it will give the red line, because since gold conjugated antibodies, gold is conjugated with the antibody, and gold is actually red in color. So it stops at the taste line and it started giving the visible red color. And we are also using the control antibody to just validate, to validate our kit. So there are 2 antibodies are here. So once this gold conjugated antibody will stops here, it started giving the visible red color. And that's how we, if the analyte has a positive sample, it will give the 2 lines, because of one is a test line, another is a control line. It gives as a positive test. And there is if negative sample, then it will only give the 1 results, and that will be the negative. If you are not getting any line, then it is an invalid. I think most of the people know about this. So this is the working principle of lateral flow immuno assay. So lateral flow immuno assay is something which looks very easy to like in on a demonstration maybe, or in our explanation, but it is very difficult, because in many things we have to be taken into the considerations, which we'll discuss during the demonstration. So, so first, a kit which we have developed, which was based on the lateral flow. And if you can see here, we have developed this, and this lateral flow, this CRP detection kit is actually very, very sensitive, which is available in the market. So limit of detection is 0.1 nanogram per ml. Runtime is 5 minutes. Normally, we can get results in 4 to 5 minutes, and results can stable up to 3 to 4 days. And it is very highly sensitive, and most importantly, it is affordable. And we have used one linker, which this is our USP, which is something gives the high sensitivity of our test. So this is we started, and we have made this lateral flow amino acids. I'm not going to talk about a lot of optimizations we have done to develop this. We have because while developing this, we have to work on how much conjugate volume we have to add, or how much sample volume we have to add, how to choose the antibody, that is something very important, or what are how to do the fabrications as well. So various aspects are there. Maybe I'm just showing in the one slide, but a lot of things we have done to developing this and optimizing and everything tools we have used it. What are the advantages of lateral flow immunoassays? Most of the people know about is high sensitivity, no instrument required, highly trained clinical staff, it's time less time consuming process, and affordable to everyone. But still we are not using in our laboratory. I think many of people will be agree with me. So product development second and third, which we have worked on, is immunokit for the CRP and FABP detection, which is also funded by DST SERP, and I got Young Scientist Project award for this developing this product. So what we were thinking is that why can't we change this? Like when we are working on lateral flow, we thought let's vertical flow immunoassays, where we need limited number of, I think we have used 4 membranes in the lateral flow, and here we can use only 2 membranes only. So again, we have done the fabrication part, performances and interpretation. A lot of things are involved into making a vertical flow immunoassay. So I will show you what is a vertical flow immunoassay, where we have used only 2 components, upper and lower plastic housing, but only 2 membranes are required only to making a vertical flow immunoassay based diagnostic, where you use NCM and absorption pad only. And if we talk about how it works, so it works on the same principles, but in maybe in a different way. So where same immunocomplex formation will occur, one antibody is actually bind with the gold nanoparticles, and another is actually kept it on the test line. I will add the samples from the vertically. Solution will go vertically, and then it will binds on the antibody, and it will again, because gold is coated with the antibody, it will start giving the colors. I don't know how many of you know about this gold nanoparticles. Maybe we'll talk about later on, because nanoparticles are involved into this, and something which is very important, and therefore we call it as a nanobiosensors, because here the nanoparticles are involved into this. I will show you when we are talking about designs and development of nanobiosensors. So similarly, like once if any sample, a positive sample is there, we'll get 2 dots. If it is a negative sample, only 1 dot, and if it is invalid, then it is only no dots. That call it is invalid. So what we have done is that the same we have reflected and worked on this detection, developing the detection kit for CRP, and we found very good results into this using our own linkers. We found very good results there. We found we are able to detect at 10 nanogram per ml, fast runtime 3-4 minutes in a serum. Low sample volume, that is something very important. We don't need very high, like in micro volumes, we sample is sufficient to detect CRP, and the cost is, we have reduced drastically the cost. So if you can see that this is a 2 dots, this is the original test kit which I'm showing here, where positive results because of 2 dots, negative is a 1 dot, and this is the invalid results. So this work has already been published in Biomedical Micro Devices. This is a very high impact journals. And I think in 2020 we published this work. Now we move towards detection of HFABP, because CRP is a common inflammation marker. This is not actually belongs to the like cardiovascular diseases. So we focused on the HFABP, and where actually we have developed the same vertical flow immunoassay kit with same results and same sort of optimizations we have done, where you can see like we are able to detect FABP at 0.1 nanogram per ml, and very fast, high fast runtime, 1 and 2 minutes in serum we are able to detect, and 3 minutes in a blood, and low sample volume is required, 30 to 40 microliters, and 40 times reduction in the cost which we found. FABP is still not available in the market. Maybe we required a high instrumentation, still is required a high instrumentation for detection of FABP, but we try to make something point of care diagnostic kit which is highly sensitive and affordable. So you can see here we again got positive results, we got 2 dots, negative results with a 1 dot, and invalid results. So we have also tested with the blood samples, we found very good results. FABP test with the 5 microgram per ml spiked blood, and 0.5 microgram per ml, again 5 and 0.5 is the sample concentrations which we have taken, we got good results. And we also seen the any specificity of our vertical flow against the CRP, hemoglobin, and glucose. We found that our FABP diagnostic kits are actually very specific. So we have almost what I'd say is followed the assured criteria, where our kit is affordable, sensitive, specific as well, and of course it is very user friendly. You just need to write a small sample of volume and you can able to detect. Now this is what we have developed, and now the question was, this is something qualitative analysis we have seen in the COVID-19 as well. Many of the COVID rapid antigen test kits and antibody test kits, which is maybe you are aware about it, maybe the pregnancy test kit. So all these test kits are qualitative. We are not able just to give the indication yes or no. So we thought, why can't we quantify? Why can't we make any device so which can be quantified, which can gives the some sort of percentage or some sort of concentrations of CRP or concentrations of FABP. That will be very interesting if we work on this. So using this Internet of Things, IoT, and various electronic parts and various things, we have made smart nanobio device. You can see this picture. This is very, I think I would say almost 9 to 10 centimeter in length. It looks big, but it is very small in a size, very portable. And if you see that this is a VFID, which I talked about earlier, vertical flow immuno device. So what we do is that we insert this vertical flow immuno device into this portable device, and we connect with a smartphone. So what happens is that it takes the image and accurately takes the image, and it starts processing that. And then we can easily connect with the smartphone and we can get the results. So keep this in a mind, like we need little advancement of in our work, and maybe a requirement of quantitative analysis. We have focused on developing a smart nanobio device. We call it as a smart because we have used Internet of Things inside IoT. Maybe it's a lot of algorithm we have used to develop these applications. So these similar applications we have developed not only for the CRP, but also we have developed for plant viral diseases as well. We also we are also developing for the FABP disease as well. And this device can be developed for any diseases. So it is not just about only CRP or FABP, but this is just a diagnostic tool we have developed for, which can be developed for any diseases. So if you any have issues, and any oral disease is something which is something which required this kind of attention, this kind of technology, we are able to develop this. So if you say this, like this work is actually has been patented recently. We have immunokit which we have developed detecting FABP for myocardial infections. So where this is something unique process which you have put into this. So this has actually been patented. So various immunokits actually we have developed. You can see lateral flow assay based or vertical flow based assay kits which we have been developed there. And now we are thinking to commercialize this, we are working on that, like how it can be reached to the people after having extensive validations part. So this is what we have worked on this, like this is CRP detection, FABP detections. I'm not elaborating how we have done it because a lot of extensive work we have done it. So, but maybe if you have any particular questions, I will be able to answer this. So if I will see the CRP and FABP, we have used lateral flow and vertical flow, which is based on the paper microfluidic, and it satisfy of the conditions of point of care testings. So this is something which we have worked on it. Now I want to talk about dental problems, which I was trying to find in the literatures, because I was not working on that, but I have to be something which can relate. Maybe you can also, maybe you can also interact with me and discuss with me how this technology can be useful for dental problems. Because why I'm showing this is because this is something we did for something else, but I just really wish something can be helpful for the dental problems. This is something I got from the internet. Maybe some of them will be agree with me, or maybe something can be added. Just this is something which is because this is not my area, but this is gum disease and tooth decay, tooth erosions, and oral cancers. This is something which is widely known dental problems. Maybe you have also faced many times in your clinics, or maybe during your internships or studies. So what I found and what I identify is that what things are possible in the technology point of view is that you can detection of oral based biomarkers, something which maybe people can focus on this, those who are research enthusiasts or those who are wanted to jump into this developing a technology. So detection of oral based biomarker with major of associated with the oral and systematic diseases are something which is people and most of the people can explore this. I just try to identify some of them. Inflammation biomarkers are IL-1 beta, IL-6 something can be focused. Tissue destructions, MMP8 and MMP9. These are the two biomarkers, and not limited. I think I think everyone of know about many other biomarkers also there, where we can see the tissue destructions, we can detect the destruction of tissues, and bone remodeling, where OPG and RNKL, you terms know very well than me. So these are the biomarkers which also I found in the literature which you can target. But these are just few of them, but many other also biomarkers are there which can help to detect oral diseases at very early stage. So what things you can do this? This is also I found interesting from the literature is that this is something people used to do earlier, but now you can convert into the POC testing, making lateral flow based technology. Now continuous monitoring is coming in this AI assisted personalized management. What I call it is oral personalized oral medicine, where you can focus on continuous monitoring and implementation implant on the lab, where this is a fourth wave. So this is something is coming in the market. So like if someone is research enthusiastic, this fourth and fourth waves, these are the three different areas where people are exploring in other diseases, not in the dental diseases. So you can focus on this. I will show you some of them. Like if you see this biosensor mouth guard, where people have printed reagents, they have pasted here, like to detect analyte like salivary uric acids. The circuit board they have pasted here, and they have just wireless data transfer. They have connected with this laptops, and they can mouth guard can be like you can detect like how much salivary uric acid is produced in the mouth. So that's how you can detect single analyte using this developing these biosensors. This is something biotransferable nanosensors, where they have they can detect multi-analyte. Sometimes they feel that why can't we detect multi-markers, multi-biomarkers, multi-analytes. So this is something technology one of the like scientists have been developed, graphene based. Graphene is a nanoparticles. So graphene based, they have immobilized an antibody on the graphene sheets. They have actually integrated on this teeth, and then deep learning and using wireless data transfer, they are able to see the presence of multi-analyte and the self-assessment. They also can do the monitoring. So this is something which is possible if someone is looking to do this. Biosensor development, not just lateral flow, but many other also techniques are there, which I have shown you here, which you can work on it. I will show you something image processing, AI based. I think many people are really interested on this AI based processing tool. You can see this is oral photo image processing analysis. You can do this. We just need many photographs about this. If you give me many images of this, definitely AI algorithm can people use it and make it a some AI based diagnostic tool. So this is a FE image. This is optical imaging, by the way. But you can make this surface plotting, and based on this surface plotting, you can identify the type of diseases at the point of care immediately. So this is a typical case with each disease is stomatitis, benign tumor, OLP, leukoplakia, SSC. You know terms better than me, but this is something related to the oral cancers, oral potentially malignant disorders, and other oral diseases. So you can do the image analysis and you can have lots of data, and that data can be used for algorithms, and we can do the AI analysis using this sort of using AI tools. So that's how you can also develop a biosensor using the AI as well. You know, alongside this lateral flow or vertical flow as some paper microfluidic as well. So I identify some of the other interesting monitoring tools which people are developing, which is a zinc oxide PDMS mouth guard. People are developing to dental caries monitoring, like before wearing, after wearing, before and after wearing. They are just trying to monitoring the analytes. That's how people are doing it. So you can do this dental caries, and this is a periodont trace, and this is a healthy tooth. So you can also monitor, like if you have a such sort of devices in your laboratory, yeah, maybe in your clinics. Dental implant monitoring is possible, like copper. Here people have used nanoparticles here, zinc oxide nanoparticles, gold and silver nanoparticles. Here you can see dental implants monitoring where people have used readers, implant sensors, multi-channel temperature sensors people are using. You know the better than me why people are using temperature sensors. But this is something people are working on it. And if you interested, if any one of you interested, can explore this. This is orthodontic treatments monitoring where stress sensor chips people have integrated on the teeth. So this is how you can monitor into this, like, because maybe I think some needs to be remodeling the teeth people used to do some sort of monitoring is also required. So that also we can do this, putting external reader into this, and humidity sensors can be integrated into this. Chemical monitoring of food ingredients is also one of the area where dental like students can be focused into this in mouth conductivity sensors and temperature sensors, which is maybe something important is in the food ingredients. Maybe the food species, like also where the area which we can focus on making some bioresponsive interlayer. Maybe these terms, you are not familiar with this, but maybe if you're not doing research, but you can develop this. This is something we can do this. Physical monitoring of food intake. So triaxial accelerometer people have fixed into this, and we can also food intake can be a monitors. So let's talk about the opportunities which I feel that in doing like understanding about this subjects, because since it is new for me. So I was trying to understand, and I did not find much literatures about this, but I found very interesting things about closely associated oral microbes, where you can see these oral and systematic diseases, which is actually associated with the microbes, where you can see that these all major diseases, Alzheimer's disease, cardiovascular disease, adverse pregnancy outcomes, and maybe respiratory tract infections. And if you see, various microbe and bacterials are responsible for those diseases, and it is actually occurring because of unhealthy mouth. People are not able to identify the relationship between all. Some of them are related, some of them are not related. But maybe when you're working in the clinics, maybe you are the students, those who are actually doing the testings of patients, you can also find the clinical significance of this. Like, is there any disease which is actually linked with the oral unhealthy mouth? That's how you can correlate, because if you can bring this data, and if you find this is something significance, I think most like those who are experienced doctor can actually maybe advise me whether it is I'm correct or not. Sometimes some of the diseases are actually associated with your unhealthy mouth and oral unhygienic oral because of oral hygiene. So is there any data available where we can find clinical significance of this occurrence of diseases because of unhealthy mouth? And if we have sufficient data, then it is alarming situation. We have to immediately identify. Yeah, we have to immediately develop this technology, a point of care technology, where when patients come to the clinic, we are able to at least give them a risk assessment, like this is the probability you have to do such more testings. So these are the opportunity for the research enthusiastic people in this group. So like if you want to focus on this, you can focus on this various kind of disease. You can find clinical significance, and if you find very good clinical relations with this association of those diseases with the oral hygienes. Definitely, there is an area where needs to be explored. I have seen in the literature, not many people are focusing on this because it is not mostly what I would say, people are not little aware about this. It's to be awareness. People don't go to the dental clinic. So of course, people will not be much aware about this, but this is the area where, like many things, many research are possible and that collaborations are possible. So this is something opportunities arises in this area. So this is my final thought. Like if we do the point of case testings in oral health care settings, that is more fruitful. So we can cure at early stage, and we can, I would say, warn patients at early stage. This is something is happening. So if you can do some initial investigation at primary health care clinics and your oral health care clinics, this is going to be beneficial to the patients. So this is what I would say unmet diagnostic needs for, in the country and around the world, which is needs to be focused. So here I'm stopping my how we develop those our kits and applications in the oral diseases. I would like to take questions from the audience, like if whatever I said and how this can be useful to developing the kits for oral diseases, and any other suggestions and comments which you find which suits to the work which are we doing and something which can be possible. So I'm going to stop it here because next section will start with how to develop a nano biosensor, what are the criteria that we'll talk about in the next sessions. So before that, I will to take some questions if anybody have any questions and any comments, any suggestions, any inputs in my literatures which I have done this. So it will be very fruitful to me, and I would like, if I'll be able to answer, definitely I will be able to answer those questions. Thank you.
Thank you so much, sir. And for all the participants, we are now open for questions. You can probably type your question in the chat, and I will read out the questions to sir, and sir will then answer your questions.
I hope everyone understood what I'm trying to say. No questions.
Sir, I think we have a question from Dr. Himanshu. How can we contact you if we want to develop any POC equipment?
Okay, it's very easy. Just talk to the Bhavana madam. She will give you my email ID and my number. You can come here. You can discuss the possibility.
So we have a question from Shailja Chatterjee. Is it possible to follow this tool for detection of early cancerous changes?
Absolutely, absolutely. Like if you have something in your mind, like some biomarkers which are in your mind, we're able to detection at cancerous changes at early stages. The technology which we have developed, the reason was the same. Like we want to monitor them. Therefore, we developed this nano device as well, because this nano device which we have developed in the kit which we have developed, that is actually affordable. So what we can do is that at every day or maybe once in a week, we are able to see and we can able to monitor, and we also able to store in our applications, right? Like when we did this tested, so we can see the progressions of any diseases, maybe it's oral cancerous diseases or some other diseases. So absolutely it is possible to follow the this tool or to developing tool for the any early cancerous changes. So absolutely it is possible.
So we have a question from Dr. Deepa Patil. What is the procedure if we want to develop a kit for oral pre-cancer?
Okay, so the procedure is very similar, which I explained you in my CRP detection. First, you need to identify your marker, like pre-cancerous marker, and then we need to identify the antibodies. Maybe if you want to work on the antibodies, because we work on both the sides. Like if you want to do antibody-based detections, or maybe you want to be nucleic acid-based detections. Like if you have something biomarker in your mind, you need to identify the antibody against those biomarker, and then easily it can be reflected in the same kit which you are able to detect. Similarly, if you want to detect nucleic acid based or something primers which you are in mind, which is belongs to the cancers, so you also can that's primers can be modified and can also be reflected to making this lateral flow as indicate. So you need to identify biomarker first, then we need to identify the related antibodies, and then we are able to reflect and we convert into this lateral flow acceleration technology. That is the procedure. And if everything is ready with you, then definitely you just need to procure it, and then I can help you. We can help you. Our team can help you to develop those kits.
So we have another question from Shailja Chatterjee. Can you make this device available in clinics or hospitals OPD?
Yes. That's the whole purpose, because the work which we are doing is 100% possible to like useful for clinics and hospital OPDs. So what happens is that it's like this validation is part is still remaining. We are looking for the collaborations actually. If some hospitals were ready to take our kits, we are able to give these kits to them. You just validate, give the results to me. We have validated up to the 100 samples. We need some more 500 samples and 1000 samples. And if what is getting high accuracy, because what we have done is that 100 samples we have done, we were almost 96%, 97% of accurate about our kit. But we need some more validations, and then definitely it is able to, we are ready to, to give this device to available to the clinics.
Sir, I have a question. I just wanted to know, you said about accuracy. What about specificity and sensitivity of the test?
Specificity and sensitivity both are very high, madam, because as I told in my presentation, is a 0.1 nanogram for FABP and 10
Yes.
nanogram for CRP, and we have also tested with the various close biomarkers of the same cardiac patient. So that is also we found very specific, because we are taking very high specific antibody, very high purified antibody. So we found very specific results. We did not find any cross interactions between the antibodies, and like some of the process actually which has involved while developing this kit, which we have kept in our mind, and that makes unique process for our vertical flow, and which brings the specificity and sensitivity both.
Sir, we have a question from Dr. Vandana Shah. Will you be able to help developing kit for monitoring glucose levels from saliva with a mobile-based app?
Yes, absolutely. Like we can help you, because all glucose, like problem with glucose are I think problem with the saliva is that what I know about is that the glucose presence in saliva is actually in less concentrations. Therefore, people prefer this blood glucose. So if you have any high clinical data about the saliva having high glucose levels, and it is a consistent, then definitely we are able to help you to developing kits for the saliva with using mobile-based app. But we must be sure like saliva has that level of glucose. Maybe you can find any clinical data, then it will be able to possible, because normally people don't prefer this saliva based glucose detection, because the level of glucose is less in saliva. So you know better than, if you know about this, then definitely we are able to help you.
Thank you so much, sir. I think yes, Dr. Vandana Shah has replied saying that we do have data on saliva glucose. So I think, sir, we can probably work on it together later.
Then it was that is fantastic. Like if you are sure about, then definitely we are able to help you. And we are looking for something non-invasive diagnostic tools. Normally people are afraid about to like blood pricking and all. If something we can able to detect non-invasive diagnostic tool, then it is a fantastic.
So we have a question from Professor Dr. Meghanand Nayak. What is the cost involved in developing any sensor?
Okay. So if you want to develop any sensors, if you want to, I would say, there are two different ways. Like if you want to do optimization all and lot of antibodies getting be used, I would say, depending on the cost of antibodies, it's something around 5 lakh for developing any sensor, 5 to some 7 lakhs. if all some facilities already available in one institutions, or then it is a fine 5-7 lakhs are enough to developing any sensor. Once you develop your sensors, kit is something is around 200 rupees of cost, just one kit. Like if you manufacture in a bulk, it will be very 75% drastically reduce the cost by 75%, something around 50 to 60 rupees. Like after developing this, and if you want to develop the applications and this portable device which I shown you, it is a one-time cost of something around 10 to 15,000. That is a one time where like many kits, like as many as kits you can detect. So that is something just variable cost I told you.
All right, sir. Thank you so much, sir. And I think now we can proceed with the demonstration, sir.
Okay. So give me 2 minutes. I'm just connecting the things.
All right, sir. All right.
How many students are like interns in this? And whatever the statistics and whatever things I told about oral disease, is this really true? I'm just asking and out of curiosity. How many like what I just wanted to ask students, like, and maybe the faculties, what kind of problems you face when patients come to them? What do you think? What and which area will you need a point of care technology, interacting with the patients, or maybe interacting with during maybe your faculty, or maybe during your studies? So I'm just asking as a curiosity, like, what do you think? What kind of questions you face, and what do you think in this is the area where we need this point of care technology? If anybody wants to say about this general like comment, I would from maybe senior faculties or maybe the students. I just want to make this session interactive. I just don't want to tell my things. I also want to understand your things. That's the only intention. Yeah, you just simply give antibiotic those who comes to the clinic. No one is interested. I hope everyone is online and they are in this lecture.
Yes, sir.
So meanwhile, I'm connecting. I just wanted to like have interactions with all of you. Yeah, you can write in a, yeah, you unmute kar sakte hain, and you can write in a chat box as well. I will be happy to understand from all of you. दिख रहा है। So, इसमें कोई ऑप्शन ही नहीं आ रहा है. बंद कर दिया क्या ये चूज है.
You have to choose another one.
फिर मैं न्यू शेयर में तो नहीं. So everyone is able to see the video.
No, sir, I think
See, I think so. Side view.
Oh, so maybe if it's possible to close the PowerPoint and then increase the video size.
Just a second. No, actually, I just wanted to do both the thing parallelly.
Oh, okay. So otherwise, no, the PowerPoint window, if you can reduce the size.
Okay, actually, during the presentation, I'm not going to show you, so don't worry. Once I will start, then I will stop my screen sharing.
Okay, fine.
So, will you able to see my screen? Presentations.
yes, sir.
अच्छा, मैंने बंद कर दिया वीडियो. वीडियो नहीं दिख रहा है. प्रेजेंटेशन दिख रहा है. Now, are you able to see the video?
No.
देखो participants में check करो. Presentation and video both. I hope you are able to see presentations and video both. Maybe video looks small. Later on, I will zoom it. Am I audible?
Yes, sir.
Okay, you are able to see both, right? Presentations and video, right?
Sir, only the presentation is visible.
You need to
Video-
pin. You need to pin this Dr. Alumai name, so maybe you are able to see this. Because we are able to see that both the things, presentations and video both.
Side by side.
You have to see you view side by side. So maybe
Side by side.
side by side speaker. You just everyone has to do this. So you have to go in a view option and there. Okay, Now able to see everyone?
Yes, sir.
Both the things, right?
Yes, sir.
Okay. Okay. So can we start now?
Yes, sir.
So like this is something this is lateral flow immunoassay based kit. So before I will start this, I will just wanted to tell you 5 minutes about how to design. Someone's mic is on.
Yes, sir. I'll mute. Right. Sir.
Hello. Okay. Okay. So before we'll start some video demonstration, I just want to tell you how to develop a biosensors. I think some of the people were asking these questions. Some maybe they can relate this. So how to develop a biosensors and what is biosensors and what are the maybe the key components which have to be taken care of while developing a biosensors. So that I'll explain you in a very short time. But also, and after that, we'll start the video demonstrations, how to make this lateral flow immunoassay. What are the components and what are the important considerations for those components, and then how to assemble this, and then we'll run the one kit, and then we can talk about this, how this can be useful. Okay, so first if you want to understand biosensors, actually it is a 2-day process, and somehow we are trying to do in a 1.5 hour. That becomes very difficult for me, but still I'm trying to explain you in the best possible way. Like somewhere and some of the terms you may want to ask me, you can ask me, because in this limited time I have to be a very precise about the components which I'm going to talk about. So let me know later on if you can understand anything. So if you want to understand biosensor, first we need to understand and most of them you are aware about the sensors. So what happens is that, like any sense and events or change in its environment and pass this information to any other electronics and computer processor, that's called sensor. And we send something, and that the event and the changes in the environment we normally pass this information to the electronic devices and the computer processor. So we can take any physical quantity which is we are aware from the long time, physical quantity like humidity, force, pressure, temperature, and flow, and we do make a sensors which is a physical phenomena, like we convert them into another form. This is a light, but we try to capture in this device. This is sensor, and this is how we detect the signal, voltage, current, and frequency. And this is a computer processing tool where we are able to quantify this. But if we talk about biosensor, so what is a biosensor? Similarly, we just have to, rest of the phenomena will be same, only changes the initial element, that is the biomolecules. Suppose you have a nucleic acid you want to detect, whether you want to see the lipids, if you want to detect lipids, carbohydrates, proteins. So as I told you in my previous lectures, glucose or maybe the CRP, those are my biomolecules which I want to detect. So nucleic acid, just those who have genetic diseases, they can target biomolecules like nucleic acid, DNA, RNA. We have seen in the COVID-19, we have targeted RNAs, right? So these are the RNAs are biomolecule for making making a sensors for COVID-19 detections. Then lipids, cell membranes, and then glucose, of course, carbohydrates. Normally we try to monitor glucose in the blood. The glucose is our biomolecules, and the proteins like CRP, FABP, and maybe some of the proteins in the oral diseases. Same phenomena, we try to understand the sensing phenomena, how we can detect those biomarkers and those biomolecules, and then we can see the signals. So some things, it is just like a host and guest interactions, right? So one biomolecules will interact with someone, and then it will start sensors. So something we need where biomolecule will start interacting, right? Then we are able to sense. There must be some guest molecule, right? And then we are able to see the changes, and then we can able to see this change in through the signals. So let us understand this technology behind the glucose meters. So maybe I don't know how many of you are aware about this technology of taste strips. So here you can see that this is a SPE, that is called screen printed electrode. But we in our layman language we call it as strips, but if scientifically we call it as a screen printed electrodes. And I think everyone we have seen this, where what we do is that we just a small drop of blood we put into this skin printed electrode test strips, and that the device start monitoring. Right? But what is the principles behind this? So like this entire SPC is actually has divided into three important components: carbon counter electrodes. Maybe you are not aware of those words, but this is very commonly known, like this words: AGGLC reference electrode, carbon working electrode. So carbon working electrode is actually very like important component where we put our glucose oxidase enzyme, right? So what happens is that like if you want to detect glucose is our biomolecule, so we have to take one guest molecule. So we are taking the glucose oxidase. So when glucose comes in a contact with the glucose oxidase, that will enzymatic process will happen, and we'll try to see the changes in terms of current, right? So what happens is that gluconic, it will convert D-glucose will convert into the gluconic acid. It will produce H2O2, and this H2O2 normally we measure through the glucometer, and that's how we are able to understand not glucose but H2O2. Remember this: when glucose will convert into the gluconic acid, H2O2 will produce, and this H2O2 will try to see in a glucometer. I don't know how many of you know. Like we know that glucose will be detected. No, the H2O2 which produced because of glucose, that we actually detect in a glucometer, right? So this is the working principle of now glucose biosensor. So like what is important into this: glucose is our biomolecule, and glucose oxidase is our glucose oxidase is our enzyme. This is a guest molecule, right? And we are trying to sensing mechanism. We are trying to measure the sensing mechanism through the current changes, right? And these electronic devices give the current ranges. So now if you want to develop any biosensor technology, any nanobiosensor technology, these are the 5 important processes we have to follow. And either you have to be this is a designing process. So this you have to identify first before designing any biosensor: which is your sample, which is your analyte, which is your recognition element, which is your transducer, and which is your signal processor. So let's start. Like if you have raw samples, it must be purified first. Like suppose you took blood samples, but you want to detect only serum samples. So that must be serum has to be purified through the sample chambers. And then it will be, the sample should be concentrated. Then it reaches to the analyte. Then analyte selectively bind the recognition element, and then it will induce the response that I talked about, the sensing event. And transducer actually that measure the sensing event and generate the signal, and through meter or through the computer processing we able to get the raw data, and then we convert into the smartphone based applications, or maybe some meters we use just like a glucometer. So this is the interlinked process. Like you can't skip anything. If you are perfectly planned this, then your sensor is sensitive and very specific. Otherwise it is not going to be a specific, sensitive, and nothing going to be help you into developing a biosensor, right? So how to follow this all process very accurately, right? Let us understand very quickly. Samples can be solid, liquid, and gas. We are taking examples of food products and agricultural products. So, but anyways, sample can be a solid, liquid, and gas, right? And so we have to choose which samples we are going to target. Like if you want to develop any biosensors for oral diseases, you have to choose which kind of sample it is, right? Sometimes maybe this lateral flow can't work if sample is a solid. Maybe it's semi-liquid, or maybe gel form. So you have to choose the technique, biosensor technique, which is actually going to be help you. Otherwise, it is not going to be help you, right? Some of you have tissues, biopsy samples. Maybe it can't be run in the lateral flow. So we have to design a biosensor based on your type of sample as well, right? Next is analyte, right? If you know, like analyte could be ions, gas, small molecules, biomolecules, organisms, and environment. Maybe your interest is the biomolecule. So you must know which is your targets. Like suppose in oral disease, in the oral cancer, I will say IL-6 is inflammation biomarker, right? So IL-6 is my biomolecules, right? Yeah, any DNA, RNA, these are my biomolecules. These are my analytes. So I know which are my analytes. So you must know which are your analyte. And you need to identify. And once you identify your analyte in your samples, then you have to find the recognition element, which I'd say receptor, or what I would say is guest molecules. And this can be many types. Antibody, it can be antibody, it can be aptamer, it can be an enzyme, it can be MIP, right? So antibody, aptamer, MIP, enzymes, right? Everyone has a pros and cons, right? Some have a strength, some have a weaknesses. You have to choose very carefully which recognition element you want to use. Someone is asking in the comment box how to design this oral cancers, biosensors. So therefore, I told you, like, if you want to make antibody-based detection, you want to make aptamer-based detection, you want to make enzyme-based detections. Everyone has some benefit and everyone has some sort of weaknesses, right? So we have to choose very carefully. We have to fulfill some sort of assured criteria where we can developing a biosensor. So this is very crucial element. And after you find analyte and recognition element, you need to find transducer. How you want to see your signal changes when these two things club together, analyte and recognition element both binds together. How you want to see the changes? So it can be optical. Lateral flow is optical detection because we see the color, right? It can be electrical. Glucometer is electrical. It can be a SERS. It can be a mechanical. It can be a magnetic, right? So these are the 5 different transducer. You can choose anyone based on your applications, based on your requirements, right? So right now we are focusing on optical detections because we see the color and electrical tools. So this is our transducer. And last one is a signal processor. One sensing event will occur in the transducer, how we will detect. Maybe human senses, visual detection, and so lateral flow is a visual detections. Maybe through smartphone, portable analytical equipment, laboratory analytical equipments. So this is a faster analysis, more portable. This is high quality data and increase the cost. So this is the 5 important steps which everyone has to follow for designing any bio sensors. We have to see which techniques we want to use for developing a bio sensor. So now these are the examples of biosensors. Like, I think you people know many biosensors, but these are some of like real-time monitoring. If you want to do, someone is asking how we can do the precancerous changes in real-time monitoring, how we can do this. Absolutely, we can do this, if you properly plan and develop any biosensors. Then rapid field analysis, also we can do that, like some of the fluorosis. We want to check the fluoride ions. We can check the fluoride ion in on-field as well. We have recently developed a potato viral disease detection tool, which is actually field deployable. We can able to detect the presence of virus and field only. So rapid field analysis is possible, and trace laboratory analysis is also possible. These are the example of food and beverages and agriculture, but you can also see the other examples, which glucose is a classic examples, right? And glycated hemoglobin, still glycated hemoglobin, CRP, glucose. We go to the pathology laboratory and we do this. We do the tests there. We don't do at home. So these are the example of biosensors. Now, exactly which I talked about in my previous slides. Let's think back to the blood test profile and laboratory investigation. Still all at millimolar level, right? We are not able to detect at very low level. So we are able to detect these all profiles when they reach to their levels. We don't detect at very early stage. So therefore, we need nanobiosensors, right? Because these are, I think everyone you very well about this. This is the 5 different diseases: respiratory, immune disease, reproductive development, gastrointestinal, cardiovascular, and nervous system. Anything happens at this major level, intercellular level or intracellular level or molecular levels. Disease progression starts from the molecular level, then it goes to the intracellular level, and then intercellular level, and then it goes to the entire body. And we are able to detect those markers and these molecules when it reaches to somewhere here in the intercellular, or maybe the respiratory disease largely happens in the body. So if you want to detect at molecular level, at very low level, then nanobiosensor is required. This is something micromolar we are able to detect, like CRP and RBCs, which we have seen in the previous slide. But if you want to reach to the femtomolar, then we have to detect at molecular level. So people are now working on single cell and single molecule analysis. So single cell, like for especially oral cancers and cancerous cells, if you can detect one cancer cell at very early stage, then we can able to prevent the progression of oral cancer diseases. So that's how this nanobiosensor can helpful, because we can detect at very low concentrations. So I don't know whether how many of you know about this micro, pico, and femto. So it is simply like if it is a micromolar, then it is 1 billionth of molecule. It is a 1 picomolar, then it is thousands. But if you detect 1 femtomolar concentration, you are able to detect 1 molecules, maybe some single cell, single molecules. That's the advantage of nanobiosensor. So these are the components of biosensor which I talked about. You have an analyte, you have a recognition elements. You will choose your analyte and recognition element very carefully by choosing the antibody combinations, antigen antibody combinations, primers, enzymes. Then you will use transducer. Then it will be readout technology amplifier, and then data acquisition and processing will happen. So detector, transducer, and the output system. These are the 3 important components which you have to be a normally we have seen in the biosensor जो glucose हमारा biosensor है और glucose का मीटर जो हमने देखा है वो biosensor, that is actually not a nano biosensor, right? But if you want to develop a nano biosensor, then you have to add one more element that is called transducing element. And that therefore, if you have seen this lateral flow immunoassay technology, we have used gold nanoparticle, and therefore we call it is a gold nano biosensor because we have used one of the nanoparticles out of those. Maybe gold, we have used gold nanoparticles, and this gold nanoparticle actually increase the sensitivity of your biosensors, because we are able to detect at 0.1 nanogram and 10 nanogram per ml because of this transducing element. And all rest of the process is same, only just you need to introduce your transducing element, and then you are able to detect at nano level, maybe the femto level. So you can depends on the modification, the recognition element, you can change the components of nanobiosensor. You need to integrate your transducer element, which is a nanomaterials, right? So in the lateral flow, because we are going to see the demonstration of lateral flow, we have talked about how to design a biosensors and detection principles. It is immunoassay based technique. We'll see now fabrications, components, and the interpretations, right? So today we are going to see how to develop a kit for pregnancy, right? But it is almost similar for COVID-19 rapid antigen test kit. So I will show you, and we will show you development of kit, how we can develop a kit for pregnancy test kit, right? And what are the components which is being used for developing a HCG pregnancy test kit. Now, what are the components which I talked about? So I will tell you which components I have chosen for the developing a pregnancy test kit. So you know what is a sample for pregnancy test kit is always urine, right? Analytes is HCG, because we are trying to detect HCG, because name itself says HCG, you want to HCG hormones you want to detect. Now what we took is recognition element, we took is HCG antibody, and as a transducer element we took as a gold nanoparticles. Transducer we took as an optical transducer because we are able to see through the naked eye, and signal process is color. We will see the color changes, not color changes, visible red color. So these are the 6 component which I explained you, and the demonstration which we are going to do for HCG pregnancy test kit. So these are the components we have used into this. So this is how you can, like, if I want to make any biosensor for oral diseases or any kind of diseases, I will first identify these 6 components. And if someone is able to identify this component, then I will be happy to help to developing any lateral flow immunoassay diagnostic kit development. And if somewhere you find to identify those elements, also we can help you in this. So this is something which someone is asking. So this maybe gave this idea how to develop any biosensor technology, right? And I have told you this transducing elements, how it is, what is the role of nanomaterial and what is the detection strategy is very simple. If you can see this video, this is the one antibody. It will form, it will conjugate with the gold nanoparticle, and it will be a conjugate with the primary antibody. It will make a sandwich immunocomplex, and it will formation of red visible line if you have seen in the lateral flow. So that is the role of nanoparticle. It will give the visible red color. Okay. So now we will start a demonstration where this is lateral flow immunoassay, and this is how it works. If you see the principles and working of lateral flow immunoassay, upper side, and below is the components of lateral flow immunoassay. So first, before I start this demonstration, I would like to say something about the expertise required and the kind of knowledge required. you must have a biological knowledge, maybe immunological knowledge, because you have to, particularly in the lateral flow, where you have to understand how to identify antibody, how to identify your primary antibody, secondary antibody, right? And whether they have any immunocomplex formations or whether they have purity or not. So this is a principle, this is something which biological knowledge is important. Little chemistry is also important. How to make a gold nanoparticle, how to synthesize, how to characterize. So chemistry knowledge is also important. Nanochemistry knowledge is also important to developing this. And third is little fabrication knowledge, assembling process, where how to assemble those kit very accurately. So you'll not get any false positive results, and the flow of solution has to be very uniform. So it is interdisciplinary subjects where you must have a knowledge of all 3-4 subjects. Then you will be able to make any lateral flow immunoassay. So by it looks very simple, by like having a 2 slides, it looks very simple. But in the developments, lot of optimization is required to make very specific. Ma'am was asking how it is become a sensitive and specific. So we have to do a lot of optimizations, and then we able to reach to this sensitivity and specificity. So here, if you see principles and working of lateral flow immunoassay, and then below is the components of lateral flow immunoassay, right? So everyone is ready to start the video demonstration?
Yes, sir.
Okay, so I will give this to my student Nidhi Verma. She is doing PhD and she extensively working on lateral flow immunoassay. So she will explain you the demonstration part, and maybe I will intervene if required in between. Like as I said earlier, this is entirely 2-day process. So I'm sorry I can't show you everything here, because what I would say, the immobilizations and particle preparations and fabrication, some of the incubation process, it takes longer time, right? So I'm not able to show you everything. I will just show you the components, how to assemble them, maybe roles of those components, and then we'll run the samples, and then I will show you how you can interpret and how it works principally. I hope this works for you. So maybe are you able to see the video clearly?
Yes, sir.
Okay. Okay, so now I hand over to Nidhi. She is going to start with the principles working of lateral flow, and slowly she will explain you about this lateral flow process demonstration.
Good morning, everyone. We'll carry on now with considering the components. What are the specific considerations that needs to be taken when you're selecting your membranes? How do you assemble these membranes? And at last, how do you fabricate the membranes? So these are the components that we'll cover now in the demo. So as sir has already told you that developing any colorimetric strip, that is a lateral flow strip, is particularly difficult since you'll require biology, chemistry, and in certain instances, you might require redesigning the whole cassette itself. So you'll require designing skill as well. So talking about the components of lateral flow, there are 4 major components in which the lateral flow is divided. As you can see, the absorbent part, the test part, the conjugate part, and the sample part. Here, this is a test strip which has been used for detection of HCG, as it is widely used. So we thought we can go ahead with demonstration of HCG itself. So starting with the first component. The first component is this, the sample pad. The next is your conjugate pad. Here, this area is the working area. This is the working area. And the end is the absorbent pad. So the flow starts with the sample pad, followed by the conjugate pad, then the test pad, and lastly, the absorbent pad. Now, we have been hearing about lateral flow since morning, but why is the lateral flow known as a lateral flow? There are 2 instances in which your immunoassay can work. One is the lateral, another one is the vertical. When you say your sample is running laterally, that is why the name comes the lateral flow assay. Unlike when your sample goes in the vertical direction, you name it as the vertical flow based assay. Here, a sample is going to run in the lateral direction, that is starting from the sample pad, then interacting with your conjugate pad, followed by your nitrocellulose membrane, and at last your adsorbent pad. So here we call it as a lateral flow assay. Now, talking about the each membrane, the first is the sample pad. So what are the considerations that you have to take when your sample pad is to be selected? First of all, it is the first material which comes in contact of your sample. And when you develop your lateral flow, there would be many different kinds of samples that come. Maybe it could be blood, it could be urine, it could be any serum. In instances, there could be plant sample. We have even developed lateral flow for forensics. So it becomes very difficult when there are trace amount of samples. So resuspending these samples and how your sample will interact with your membrane. So it is very crucial when you select your sample pad. Here, this is a sample pad. This sample pad is made up of cellulose, but there are many different materials which can be used as a sample pad. It could be a nylon mesh, it could be any polyester. So there are various material which are used while selecting your sample pad. The very important consideration when you select a sample pad is that your sample pad should only retain your cell debris and allow your antigen, just in case there was a question regarding glucose, right? So your sample pad should allow flow of glucose and take away the rest of the material in the sample pad itself. It should not interact with any other part of the membrane of the lateral flow at all. So that is the specificity of sample pad. It should take away your antigen from the sample and help it giving it to the next membrane, that is your conjugation pad. Here the red ones, these are your conjugate pads. Now these are red in colors because we make use of gold nanoparticle that would ultimately help you in any optical detection. So for conjugate pads, again there are list of conjugate pads which you can use. It goes from glass fibers to cellulose to again polyesters. There are various sizes of conjugation pads which has been used. It may be from 100 to 500 micrometers till your nanometers, depending upon the size of your antibody. Now the choice of a conjugate will largely depend on your molecule of choice. Like you have seen in the elements or the biorecognition materials, like there could be an antibody, it could be a nucleic acid, or it could be an MIP. So based on that, the choice of conjugate pad will vary. Just instance, if I have an antibody which is of 200 nanometers, so I have to use a conjugate pad that could allow the flow of 200 nanometers of my antibody, but it cannot allow the flow of other materials which might interact and gives us the false positive or false negative results. So these are the pre-considerations that you have to take when you select a conjugate pad. Now, so some prerequisites for a conjugate pad is that you have to see if it can be stored for a longer period of time, because when you pack your strip, it will be exported. You don't know when the end user is going to use the strip. So it should be highly stable. It should keep your biomolecule, say your antibody. It should keep your antibody pretty stable for a long period of time so that you can easily interpret your results. And there are fair chances that it might get destructed over time. So you have to do a range of studies of stability regarding your biorecognition molecule and its interaction with your membrane. Next, you have to see if there is any pH adjustments which you have to take into consideration when you are using some particular conjugate pad. So these are some little things which I'm just saying, which are some prerequisites for your conjugate pad preparation. So the next and the most important part of the test kit is your reaction zone or your nitrocellulose membrane. This is the core of your reaction. So this is how the test strips initially looks like. So these are the zones where you place your antibody. You can see there are two dots. So each dot would signify that there is a control and there is a test. I've just marked it here so that you can clearly see where do we place our antibodies. Okay, so these are the place where the reactions will take place, and your antibodies, that is your primary antibody, would be placed for completion of your immunocomplex. Now, your nitrocellulose membrane comes in micron size. Now, it could be a cellulosic material, it could be a PVDF membrane. So again, it depends on the type of your sample. It largely depends on the type of the sample. Mostly which is used is 0.2 to 0.5 micron, which is, it works well with most of the sample sizes. Now, what your nitrocellulose membrane will do is, once your sample is put, it interacts with your conjugate pad, it will help you via capillary action for your sample to push forward so that you can see a visible change or a visible color. So that is the most important part. And this nitrocellulose membrane is very pH sensitive, it is humid sensitive. A little change in humidity and you can see there is a large variation in your results which can occur. So when there is optimization studies, it has to be in a very controlled environment. There should be no dust, and the humidity has to be maintained about 12%. So these are the considerations that you have to do when you optimize your nitrocellulose membrane for making any biosensor. Now, lastly, we come on to the last one, that is your absorbent pad. As the name suggests, the main function of your absorbent pad would be to absorb all the extra material which was there in your sample, so that it does not lead to any false result. So in instances, there would be case that someone or some end user might have overused a sample. They might have, if the strip says that you have to use, suppose 1 ml of the sample, but the end user have used 2 ml of your sample. So now there would be a possibility that your sample would backflow. So when your sample would backflow, that could lead in some negative results, which may be false, or in positive results, which may be false. So you have to take into consideration that your absorbent pad can take away all the samples which are not required and there is no backflow. So these are some prerequisites for your absorbent pad. Now, I'll just show you how do you actually assemble or how do you fabricate this 4 component to make your biosensor work. So this is your test strip here. I've marked it just to show that one is the test and one is the control. When we assemble the test strip, we have to take care that we do it in the reverse order. The reverse order is starting from your absorbent pad, then your nitrocellulose membrane, then follow to the conjugation pad, and lastly your sample pad. So first here we'll place our absorbent pad.
So it's clearly visible to all.
Yes, sir.
Okay, so if someone wants to see only video, they can the view option, they can remove the side by side so they can see this.
So now we have placed our absorbent pad. You have to see that your absorbent pad is closely linked to your testing area so that there is a flow and there is a connection between the 2 membranes. If there is no connection, there would be no further flow between the membranes and there would be no results, or maybe false result could occur because there was no connection between your nitrocellulose, the testing area, and your absorbent pad. Now coming on to your conjugation pad. In the nitrocellulose membrane, you have to load your membrane, you have to load your antibodies. Now loading for your antibodies, it takes a process of whole 2.5 or to 3 years for loading it and making it ready to use. So we have to skip that part, but this is the place where you have to load your antibodies right here. And after that, you have to place your conjugation pad. Here I have already pre-prepared the conjugation pad. The red colored, this is the conjugation pad. This will go right after your nitrocellulose membrane. Again, you have to take care that it is interacting with your nitrocellulose. It has to be attached. Otherwise, if there is no flow, there would be no capillary action and your sample will not flow forward. So you have to stack it over when you fabricate. You have to take an attention for that. Now, the next one and the last one would be your sample pad. So here, this is your sample pad. So now this sample pad is a cotton padding. So this is a preferred material which we have been using for maybe HCG. So for this, you just have to place it here. Again, you have to see that it is stacked over your conjugate pad. So once you put your sample, it will interact with the second membrane, that is a conjugate pad. It will interact with your loaded antibodies, and ultimately, which is unreacted, will go to the last membrane, that is a absorbent pad. So this is how you will fabricate a biosensor.
So if you have any question, till this, like somebody wants to ask, tell, because once we are going to run it, I will show you the components as well, like which antibody and how we use this antibody, components of antibody. And if you have any question, you can ask right now. So we will be able to give you the answer right now.
Okay, since we are going to perform HCG today, so we have a negative control, we have a positive control. Here we have gold nanoparticle, which was already loaded on your strip.
This gold nanoparticle is actually already conjugated with our HCG antibody. So now we have directly, because it takes 1.5 hours to immobilize on conjugation pad. So we are able to skip this process. These are the three components basically we use. For the nano fabrication of this trace strip. So if anybody have a question till then we'll run the sample. Like before we run the sample, if anybody have a question related to this fabrication part, you just tell me. So any question related to this? So this is, we have actually fabricated to explain you how to fabricate this, and some immobilization techniques is still, we have actually done this already. So now we will run two samples, positive samples and the negative samples. And you can see how you can differentiate and how you can interpret both positive and negative samples. So no question, then we'll start running.
Yes, sir, we can start.
So this kit is already we have prepared for today's session. We will, and the same fabrications we have done this in this. If you once we'll open this and show it to them, we will open it and show it to you. The same thing, because we need some proper fabrication. So we already done this. If you can see this. So this is already we have fabricated with the proper immobilizations and all. So now we will run the samples. You can see how it looks like.
This is a positive control for HCG. Here is your sample port where I'll place our sample. You can see there is a red coloration, that is because of your gold particle. Here simultaneously we'll run a negative sample as well.
First, we'll run this positive and then we'll run negative samples. Positive, negative samples, Claudia? Okay. So it takes time to flow and get visible, proper visible results. So we have to for 2-3 minutes. So now you can see that the positive control we have 2 lines and the negative control only we have 1 line. Right now we'll open this kit and we'll show you how what things are happening inside and why we are getting 2 lines. Nidhi, explain to me.
Here in the positive case and both in the negative case, you can see that the red color membrane, the gold conjugation pad now is white because your sample has taken away the gold conjugate along with it so that it can interact with your test and your control zone. Now the reason for a positive line or 2 line is simply that your antigen was present in a positive sample and it could lead in the sandwich immunocomplex formation. However, in the negative case, there was no antigen present and there was no sandwich immunocomplex formation. Hence, there is only a single line here. Now we can see that the extra sample which is there, it is getting absorbed on the absorbent pad. Absorbent pad is slightly now red in color because the gold which is unreacted, the antibody and the sample which is unreacted going and flowing and is depositing now on your absorbent pads here.
Okay, so this is how we can fabricate and this is how we can run the samples and how to this is the way we can interpret. So this is entire process. Normally we follow some clean room facilities or some sort of keeping cleaning as a priority, then only we are able to get a good results. So these are the precautions is required. So therefore, we're not able to show you this everything, but it is a 2-day process like fabrication and modelization and storage and incubations and all. So I hope you understood. Now I will show you vertical flow. Just cassette I can show you right now. So same vertical flow, how we run this. So is there any question related to the lateral flow or so then maybe. So this is a vertical flow cassette which we have developed for FMBP And now this is same two membranes are involved into this. One is a nitrocellulose membrane, another is absorption pad which is inside. So we don't use any sample pad and any other absorption pad, which actually reduce the cost. And the same we have actually made for FABP and CRP. You can see two dots. So we don't put the lines here, we just use two dots, which also reduce the usage of antibody. So that's how we try to reduce the cost and create affordability. And also reducing the elements also we are reducing. So that's how we reduce the affordability. Sorry, that's how we create affordability of those critical flow immunoassay kits. So this is about lateral flow and vertical flow immunoassays. I would be happy, like maybe in some days we can do this at live at Sumandeep, because it's very interesting. I really want this kind of exposure is needed to the students, so they can make such sort of devices. Now I will show you, this is optical sensor. Then during this, while designing the biosensor, I told you about electrical sensors, right? So this is optical sensor. We can, by visibly we can see this. But if you want to develop something test strip based, like glucometer kind of devices, we also work on this. This is SP, normal skin printed electrode. It will look like same as glucose strips. So where you can, same process you can follow. You need to take antibody. You can just need to immobilize your antibody on the surface working area. You can see there's a black dot there. So in the area of this working area where you have to immobilize your antibody, and then you have to add your antigen, we can see this the response between the reaction between antigen and antibody using the smartphone based applications. So that all we also do this. We have already developed for the plant viral diseases. So here actually you need some expertise of electronics or maybe electrical expertise. So therefore I told you, like if you want to develop a biosensors, so then you need a very different the areas of expertise which has to be needs to be overlapped, and then that's how we can develop those biosensor. So this is called electrical biosensor, electrical nano biosensor, and the previously which I showed you this lateral and vertical, those are optical nano biosensors. So this both can be replicated for any kind of applications, or whether it is oral diseases or diseases related to your interest. Okay. So this is all about demonstration part where we have shown you. Maybe I hope you'll be able to understand. So we will be happy to take some questions. So and then after that we can end the session.
Sir, are these kits commercially available right now, or can it be made commercially available at a later time?
Yes. Actually, we have validated with 100 sample, but we want to validate with the more samples. If we are able to get some 1,000 samples data, so then definitely that will be commercialized. So our side, we are done with our proof of concept. It just need to be a little more validation, and then it can be commercialized. We are looking for some hospital collaborations, so we can give it to kit to them. They can validate, they can submit the data, and then it is obviously can be commercialized.
Thank you, sir.
Sir, we have a question from Dr. Himanshu. Can we use any other material or metal in place of gold for nanoparticles?
People are using different nanoparticles like silver nanoparticles and quantum dots, but we don't normally advise to use other nanoparticles because sensitivity and the what I would say, gold nanoparticle has a high sensitivity, and also it has a high optical property, therefore we use it. Other nanoparticles do not offer those sort of properties. Some people are used fluorescence nanoparticles, but you need a fluorescence reader to see two lines. So therefore, again, you need additional instrument to see it. So therefore, we don't normally prefer, but yeah, you can use it. Like there are two things. Like if you want to publish a paper, then definitely you can use it. But if you want to commercialize something and looking for the technology side, gold is most preferable nanoparticles. Yeah, but this is for optical I'm saying. But if you want to make electrical biosensors, then definitely you can use other nanoparticles, because for optical sensor, we are not using gold. We are using Prussian blue nanoparticles. We are using graphene quantum dots. We are using copper nanoparticles. Yeah, so it depending on the applications. If you are optical biosensor, then gold is most preferable nanoparticles. And if you are making any electrical sensors, then other conductive nanomaterials we use. Yeah, so that's how you can choose your transducing element or nanoparticles.
Dr. Jasuma,
Yes, ma'am.
any questions?
No, ma'am. Actually, it was quite informative. Whatever questions I had, sir had answered in his demonstration and this thing, and his presentation.
Thank you so much, sir, for the informative lecture. May I now request?
Any other questions? President sir is going to join in a 5-10 minutes. Can we? I think can we wait for it?
Yes, sir.
Because we have given him a 15, 20, 25 timing, so he will join. So meanwhile, again, we can have interactive. If anybody have any other questions, or if you want to say something just about the session, I don't know how much it is informative to them, or it is going to be useful for them. So I will be happy to have any comments related to this.
Sir, I was interested in the CRP, the one that you said in the in your presentation, and what you're working on in CRP. So, in this, what exactly are you working on? If you could elaborate a little bit on that. You said something about heat shock, CRP, and hard fatty acid binding protein on myocardial infarction. Can you just tell me a little bit about it?
Okay, so this CRP actually initially we had targeted on for inflammation as an inflammation biomarker, like to see any kind of inflammation in any the blood samples, or maybe rising of somebody have a maybe heat stroke, or maybe someone has a can fall in some places, or maybe like wherever the rise of CRP level. So we thought like, why can't we make, because CRP is also sometimes crucial for the cardio as a cardiovascular risk factors. So keep this in mind, like we have developed this CRP detection kit. So where we normally use blood samples as well, serum sample as well, where like high amount of CRP present in this. So we try to detect at very low level, and especially in our blood samples, and especially the cardiac samples, where we're trying to analyze how much amount of CRP present and how much low level of CRP we can able to detect. So we are able to detect this optically. We are able to detect up to the 10 nanogram per ml. But yes, similarly, CRP is, again, as I said, CRP is not actually cardiovascular biomarker, disease biomarker. It is not very specific for the cardiovascular disease. Like for any inflammation happens, normally we do this CRP detection. So make it more specific for the cardiovascular disease. HFABP is very specific biomarker. Like any person having a chest pain because of cardiac arrest, it immediately released within 1 hour of in our body. So so therefore we were able to identify FABP at very early stage. Troponin I and D actually also previously biomarker in hospitals.
Yes, sir.
Yeah, troponin IT still people are using in hospital to see the severity of cardiac arrest.
Myocardial infarction. Yes.
Yeah, FABP is still not introduced. Maybe some machines are not available. Maybe people are, I don't know. I haven't talked to the hospitals, but yeah, this I think 3 years back, some hospital was saying they're going to purchase one machine for FABP detection. So FABP is something we can detect we could release that very early, so we have to detect at early stage. And that also we are able to achieve up to the 10 nanogram, 1 nanogram per ml. So like, because what happens is that we are able to FABP or troponin when it's reached to the milligram level, not at nanogram level, because we do not have any device which can detect up to the nanogram level. So person having a like release of this troponin I and FABP in the body milligram level after 1 hour. So what we thought, can't we detect it very early, like someone has a chest pain, why can't we detect some sort of maybe marker we released in the body at nanogram level? So we can monitor continuously. So like some people might not have a chest pain because of cardiac arrest. They might have a gastric problem. They were slept on other side, or maybe in a different odd side. So
Yes.
sometimes they feel the pain. So how we can eliminate? So therefore we design this. And also one issue is that in the car, like especially in the rural areas where people travel to the tertiary hospitals, it also have chest pain. And it will almost 8 to 10 hours to reach to the hospital. So meanwhile, if we able to detect because of this cardiac arrest, so we can give some medicines and we can save the patients. But people get started first, like what I would say, will be in a fear and they rush to the hospitals. They don't start any treatment and something. Maybe ECG, echo, they do it, but it's not more informative. So that's the purpose, like CRP and FFP detection kits, which we have done.
Sir, in this you have said about early detection. So how fast does the detection occur? Like usually the test for CRP that we do in labs is immunoturbidity. So in that, I think the study takes at least 3 minutes minimum. So can you just enlighten on how fast the early detection is?
Like based on our experiments, we normally write like 1 and 2 minutes, but you have seen that in 30 seconds, 40 seconds, we're able to get the results.
Okay.
You have seen that right now, just we added a sample in 30 seconds, we're able to get the 2 lines.
Yes.
30-second max I said, but as immediately I add in a couple of seconds, you get the results.
Okay.
Sometimes what happens based on the samples and based on the target, sometimes it takes time. So on an average, we say 1 and 2 minutes, but ideally it happens in 30 seconds.
Okay. Sir, have you done test with high sensitive CRP and CRP because you're working on CRP? These are the two laboratory investigations that they do on CRP. So high sensitive CRP is basically they do it for very small samples. So has there been any study been done on that in your institute?
For high sensitivity, yes, we have done with a high sensitivity test as well, because since we are able to detect it on 1 nanogram, so we've taken some samples from the hospitals, we are able to detect it high sensitivity.
Did you find any difference, or was it at par with the results of high sensitivity CRP?
So normally what happens is differences happens, but what happens in like the range which is of worry is CRP is already defined, right? So like it's on the range of 40 to 60, it comes, then only it is severe. So it is give the indications, like if you monitor, what I feel is that sometimes you find that 100 nanogram per ml. So we can say it is increasing. So you have to take care of this. Like someone has a like mild in strokes, or maybe has a little severe stroke. So they can monitor it. Oh, this is infection level is going to increasing day by day. Someone is taking antibiotics, whether it is getting decreasing or increasing or not. So it is help to monitoring and also assessment process as well. So that way it help. We found that difference in this, but the criteria which needs doctor attention is that there's a defined range, I would say.
Okay, sir. Thank you, sir.
I think President sir is here. Good afternoon, sir. Is there any question?
No, sir. Not as of now.
Now we can proceed. I think President sir here. So I think now we can proceed for the validatory process.
Thank you so much, sir. May I now request the Dean KMS DCH to kindly present the certificate of appreciation to our guest speaker for the day.
Thank you so much for inviting me. Thank you so much.
One second, sir. Just a second. Yes, sir.
Thank you so much, sir. Very nice presentation. Very useful, especially to our specialty. So we are very honored and grateful to you for such a wonderful presentation. And I'm sure all the participants must have become wiser than before. Thank you so much.
Thank you so much, sir, for giving this opportunity and interacting with the students and faculties. I think some of the senior faculties also were there. So I'm very glad to see the interest of this particular lecture. So thank you so much for inviting.
I now request the President IAR to kindly share his views for the program today and about the collaboration with KM Shah Dental College and Hospital.
Good afternoon, everyone. Thank you very much for this opportunity to have a few words. First of all, thank you indeed for agreeing to host this event, admittedly online, but still you are the host. I think the concept of biosensors is nothing new. Ever since the stethoscope became popular tool in health sciences, numerous other devices have come up. But what is new is the need for us to focus on the area of biosensors in a systematic way, rather than discrete developments, if you like, individual pieces of devices being developed in isolation. And this is particularly the case when the number of endemics and pandemics has been growing in the last nearly 25 years. And the projection is that we are here to live with these kinds of challenges. So our planning and preparation for how do we actually manage preventive healthcare has become even more important issue for us to deal with. We at IAR, as you probably have been introduced to, we started as a research institute in biotechnology. And the biotechnology itself is a very broad field. It's a multidisciplinary concept. But our strengths are really in cell biology, disease, biology of disease, in addition to, of course, the traditional biotechnological processes and systems. So as part of that, we have been working in the area of biosensors. Alok Pandya is our leader in that area. So I'm pleased that you had an opportunity to listen to him. I understand there are some 40, nearly 50 people from the two colleges, Sumandeep Vidyapeeth and the Dental College. I see this as an introductory session for a long, mutually beneficial partnership between our institutions. No multidisciplinary activity can be accomplished by either an individual scientist or even an individual institution. So the future is multidisciplinary. There is no concept of discipline-based education or research. Everything is multidisciplinary. And therefore, working together with other colleagues, other institutions who bring complementary expertise and experience has become even more important. So I do hope with the skills that you have in clinical medical sciences and with our biomedical science experience, IAR, Sumandeep Vidyapeeth and the Dental College can break new ground in a range of health-related applied sciences. And in this case, of course, today you have been talking about biosensors. So thank you very much indeed. And thank you to all the participants for taking time to join the session. And I thank Manish Parmar from our side for coordinating this. And more importantly, I must thank Dr. Alok Pandya for leading the session. So thank you very much indeed, and good to see you all. Thank you very much for this opportunity. Thank you.
Thank you so much, sir, for sparing your valuable time and addressing all of us, and for this collaboration as well. May I now request the program coordinator, Dr. Bhavna Dave, to kindly deliver the vote of thanks.
Hello, everyone. Good afternoon to one and all. I'm very thankful to the Institute of Advanced Researches, University of Innovations, Gandhinagar, and also to the President Sir and Mr. Manish Parmar for having this wonderful, informative session on biosensor. I can say nano biosensor, with all the new ideas and the new components of optical and electrical, as well as nanoparticle incorporated in it. It was a very interesting session. I thank Dr. Alok Pandya for the same, for giving us this beautiful information and very informative session. I'm also thankful to Sumandeep Vidyapeeth for this program, IT section of Sumandeep Vidyapeeth, KMSDCH for this very new kind of a program this time. I wish that we could have done it in person, offline. We would definitely love to have the offline programs with Institute of Advanced Research. And I'm very thankful to our Dean, Dr. Subramaniam sir, for making this program and this webinar very successful. We are looking forward for the collaboration with the Institute of Advanced Research, University of Innovation, Gandhinagar, and we are really thankful to Mr. Manish Parmar for making us, do this program. I thank Dr. Jasuma for doing all the hard work and working, for this program to happen so well. Thank you so much, all of you, for attending. And, I am very sure that we have learned a lot today. And, certain things which were there in the mind and certain ideas which we could not even think that we can do it. I think we all are very positive about it now. And I'm expecting much more from my faculties now. Thank you so much, President Sir, Dr. Subramaniam Sir, Mr. Manish Parmar,
Dr. Alok Pandya, and the entire team. Thank you so much. And thank you so much for making this program, very interesting. Thank you.
Thank you so much, ma'am. So before we conclude today's session, let us visit the Sumandeep anthem, and I request all the participants to kindly up the volume to listen to Sumandeep anthem.
सुमनदीप के जो गिरधर हैं, हम सुमनदीप के जो गिरधर हैं, ज्ञान दीप की ज्योत जली है, नव सर्जन नव विचार धारा लेकर बहती लहर चली है। हम सुमनदीप के ज्योतिर्धर हैं, मंत्र मिला है मानवता का, स्नेह सभर ममता का, मंत्र मिला है मानवता का, स्नेह सभर ममता का, सेवाव्रत संदेश मिला है सबके प्रति करुणा का, ज्ञान मिला है शिक्षा पाई, सेवा की एक लहर चली है। हम सुमनदीप के ज्योतिर्धर हैं, कर्ज नहीं भूलेंगे इसका जिसने विद्यादान दिया है, कर्ज नहीं भूलेंगे इसका जिसने विद्यादान दिया है, शीश झुका कर वंदन इसको जिसने गौरव का सम्मान दिया है। सौरभ देखो विद्यापीठ की गाँव-गाँव बात चली है, हम सुमनदीप के ज्योतिर्धर हैं, हम सुमनदीप के ज्योतिर्धर हैं, ज्ञान दीप की ज्योत जली है, नव सर्जन नव विचार धारा लेकर बहती लहर चली है। हम सुमनदीप के ज्योतिर्धर हैं, हम सुमनदीप के ज्योतिर्धर हैं, हम सुमनदीप के ज्योतिर्धर हैं।
Thank you so much, everyone, for being with us today. And before bidding goodbye, I would just like to remind all the participants to kindly fill in the feedback forms and send it back so that the certificates can be dispatched for you all. Thank you.